Now that should be a review because we almost totally use some type of pre-med, and we usually use a cocktail. So that should be reviewed at this point. That should be a way of doing surgeries familiar to us all. So let us now take that same concept, but now apply it to the osteoarthritic patient. Same thing that we're familiar with, but taking a new area in which we're going to apply the same principles. That being the multimodal approach to managing canine osteoarthritis. What we are implementing with the multimodal approach to osteoarthritis is these two overlapping triangles. Now they appear somewhat as a star here, but if you then consider each one of the triangles, we have on the far left, below this illustration, the pharmacologic approach, again with the NSAID, the chondroprotectant, and the adjunctive drugs. And then further to the right of that, then you now see on this triangle the non-pharmacologic approach, which is with physical rehabilitation, the EPA-rich diets, and the exercise together with weight loss. Previously, we talked about those cases which are requiring surgical intervention, and usually that is for stabilization of the joint, talking about stabilization and the inflammatory or the cytokine-mediated process. I grant you that some of those cases do need surgical intervention, but that is not the focus of this presentation. The focus of this presentation is more on those conservative, if you will, modalities. So given that surgery is indicated for some cases, what we're looking at first is weight control and exercise. Nice study done previously by Gail Smith and his colleagues at University of Pennsylvania. And in this study, in most simplistic analysis of the materials and methods, Labradors were looked at, and within a litter, half the litter got ad libitum feed, and then the other half of the litter got virtually 2/3 of what their litter mates ate the day before. And then there was an analysis of the prevalence and the longevity of these animals over their entire life. So as you look at the graph on the left, you can see the progression of osteoarthritis in the dogs that were free-fed and the dogs that were on the restricted food, that being 2/3 of what their litter mates ate the day before. Obviously, a considerable difference in the progression of the disease. Further, at the end of the study, which was the end of the life for these dogs, the prevalence of OA was 83% in the dogs that were free-fed and 50% in the dogs with the restricted feed. That is huge. The difference of 33% is huge. So if we back up and look at the illustration on the right, we'll see the longevity of these animals. And discovered through this investigation that the animals that were on the restricted food lived an average of 1 to 1.5 years longer. So simply by the caloric content that these animals consumed, there was a difference not only in the progression of osteoarthritis, but there was also a significant difference in the longevity of those animals. Now next we look at the composition of the cartilage, and what we're seeing here is the fibrillation of the tangential layer of the cartilage, which is one of the first gross changes in the cartilage in osteoarthritis. And then these two illustrations here depict, first of all, that the structure of the cartilage itself is the aggregan, which would have the glycosaminoglycans on this hyaluronic backbone, and then around them the type 2 collagen. And it's the type 2 collagen that constrains the swelling of this aggregate. And so when the animal has the extensive hydration through these glycosaminoglycans, and again, the glycosaminoglycans are negatively charged and so they attract water. Subsequently, this aggregate wants to swell. However, that swelling is constrained by the type 2 collagen. And about 75 to 80% of cartilage is water, which is what makes it a great shock absorber. Actually, the role of cartilage, we've been taught for many years, is a shock absorber. It's really not so much a shock absorber. The subchondral bone is the shock absorber. The cartilage helps distribute the load such that it causes the cartilage to be more uniformly coherent to the other side of the joint. So the water that's in the cartilage allows that to occur. And then the little triangle that we see there in the bottom left-hand corner is meant to illustrate that the matrix metalloproteinases, which degrade the cartilage, are typically held at bay by the tissue-inhibiting metalloproteinases. And in the normal, healthy joint, these TIMPs would counterbalance the degradative effect of the matrix metalloproteinases. In the case of osteoarthritis, you see this unequal distribution, and degradation now takes over. Again, there is a correlation between structure and function. So now we look at the role of the high eicosapentaenoic acid diets. And let's look at how they work. On this illustration, we can see arachidonic acid in this upper left-hand corner. You can see that this component of the illustration is meant to represent the cell membrane, and the little red balls represent arachidonic acid. This is constantly degrading because you know that cells are continuously degrading, and they go through degradation by cyclooxygenase 2 enzyme, and the end result is prostaglandin E2. Now, the prostaglandin E2s are upregulated about 50-fold in the presence of osteoarthritis. That is why when you apply an NSAID, you're trying to block the production of prostaglandin E2s so as to keep that in check. Now, when you administer diets that are high in omega-3 fatty acids, what occurs, as you can see in the illustration, is that the little black stems in the upper left-hand corner have been replaced with yellow stems. And that is to represent that the arachidonic acid has been replaced by a different substrate. That substrate being the eicosapentaenoic acid that is derived from omega-3 fatty acids. Now, those EPA components are degraded in the same process, that being by cyclooxygenase 2. And in so doing, then we see that the end result is prostaglandin. Yes, it is. But it is prostaglandins of a different series. It is no longer prostaglandins of the E2 series, but it's prostaglandins of the E3 series. And that series of prostaglandins is arguably anti-inflammatory, or at least less inflammatory. Therefore, in summary, by substituting the substrate, that being arachidonic acid by eicosapentaenoic acid, the end result is a less inflammatory response. That is one manner in which the EPA diets have their activity. Here's a second. You can see in the upper right-hand corner, we're trying to illustrate here what the cartilage actually looks like. You see in the square what would be a cross-section of the cartilage, and just pulling out that cartilage matrix, we have the aggregan aggregate that is now in somewhat of a yellow presentation here. That is the functional unit of the cartilage. So we have that bottle brush appearing structure with the high hyaluronic backbone all put together, encompassed by type 2 collagen, and now we have the functional unit of the cartilage. Now when you have osteoarthritis, you have an increase in this enzyme aggreganase. And the aggreganase, as the term implies, you will recall from your schooling that any term that ends in ASE suggests that it's an enzyme that degrades whatever is in front of the ASE. So if you were to suggest that aggreganase is an enzyme that destroys aggregan, the functional unit of cartilage, then you would be right. That would be what happens. So when you administer the EPA diet, it suppresses that messenger RNA that gives rise to aggreganase. As a result, the aggreganase is depressed, the degradation of the functional unit, the aggregan aggregate, is suppressed, and you preserve the integrity of the cartilage. Therefore, we really have two functions of that EPA diet. One is to retain the structure of the cartilage, and the second is anti-inflammatory or less inflammation as a consequence of substituting a different substrate. What evidence do we have for this? Here's evidence that is derived from the Hills JD diet, and the reason that I select Hills to exemplify the evidence behind this is because, unlike some of the other manufacturers which may have high EPA diets, unique to Hills is that, at least at this point in time, they have clinical trials that document the actual results. So first off, we see in this illustration what the systemic levels of the EPA is when administered. Secondly, we see that when the animal is put on a force plate, and we'll talk about force plate in another lecture, but force plate gait analysis arguably is still about the only objective technique of looking at results of these kinds of drugs or diets or so forth. So you do see a statistically significant difference. Further, you see that from the pet owner's observation that there is a statistically significant improvement in these activities resulting from the administration of the EPA diets. But here's the clincher as far as I'm concerned. These particular dogs were, for the study, on carprofen. And they were on carprofen, of course that being an NSAID for analgesic features. The observation being that if you had these dogs on that NSAID and you were concurrently administering the EPA diet, you could decrease the amount of NSAID by 25%. We go back to our early premise, which was that by multimodal approach, you are trying to reach a minimal effective dose of the drugs. And what better example of that than this study here? If you can decrease the dose of your NSAID by 25%, and therefore the sometimes related adverse events associated with it, then that would be an objective. So this study illustrates that indeed, if you're implementing EPA-rich diets together with an NSAID, that you can decrease the dose of the NSAID.